Hello, hi. Myself Pradipha here to explain with the topic concepts of infection and barrier nursing. Okay, let's start with the definition of infection. Infection is the invasion of the body by pathogenic organisms that multiply and produce harmful effects. Next, we can see what is communicable disease. Communicable disease is an infectious disease, also called contagious disease, spread from one person to another or from an animal to a person, either directly or indirectly, by an infectious agent such as viruses, bacteria, and fungi or its toxins. The examples of communicable diseases are cholera, hepatitis, influenza, malaria, measles, and tuberculosis, etc. Next, we can see what is incubation period. It's the period between the infection of an individual by a pathogen and shows various signs and symptoms of the particular disease. Next, we can see who is a carrier. Carrier is an agent that transmits the infectious agent from one person to another without showing any signs and symptoms of the disease. Next is infection chain. The chain of infection is a process where certain conditions must be met in order for a microorganism to be spread from person to person. This chain can occur only when all the links in the chain are intact. By breaking this chain at any of the links, the spread of infection is stopped. We can see the links one by one. First one is causative agent or infectious agent, or simply we can say it as disease organism. That is nothing but invading organisms. The examples for the causative agents are bacteria, virus, fungi, etc. Next link is reservoir. That is the environment in which the invading organisms live and multiply. Next is portal of exit. It is the mode of escape from the reservoir through respiratory tract, gastrointestinal tract, etc. Next is mode of transmission. It is a method by which invading organism is transported to a new host either by direct contact, air, food, etc. Next is portal of entry, where the organism enters to a new host either by respiratory tract, gastrointestinal tract, broken skin, etc. Next is susceptible host. Susceptibility is determined by factors such as number of invading organisms, duration of exposure, age, state of health, nutritional status, etc. Next, we can see the physical and chemical methods used to control microorganism. First, start with the physical methods. First one, heat sterilization. It includes moist heat, dry heat and pasteurization. We'll start with the moist heat. In that, first one is steam under pressure or autoclave. It usually operated at 250 degree Fahrenheit or 121 degree Celsius. The time needed for the procedure depends on the articles to be sterilized. The next one is boiling water. Here, the object to be sterilized immersed in water and boiled for 15 minutes. Next one is dry heat or hot air oven. Here, the operating temperature is 310 to 338 degree Fahrenheit or 160 to 170 degree Celsius, usually for 2 hours. Next one is pasteurization. Here, the process of pasteurization involves heating milk to 71.7 degrees Celsius for at least 15 seconds and not more than 25 seconds. Once the milk has been heated, it is then cooled very quickly to less than 3 degrees Celsius. Okay. Next one is radiation. All types of radiations are injurious to the microbes. That includes gamma rays and ultraviolet rays. Next method is filtration. Here, the removal of microbes from liquids by means of porous materials. This method is mainly used to sterilize drugs, culture media, etc. Next method is refrigeration. Here, low temperature inhibits microbial multiplication. Mainly this method is used for preserving foods. Next is hypertonicity. By their osmotic effects, hypertonic solutions inhibit microbial multiplication. The last method is desiccation. Here, the removal of water, bacterial spores and certain vegetable cells resistant to such other treatment. Here, the method is mainly used for food preservation. The next method is chemical methods. Here, the mainly used chemical agents are antiseptic, disinfectant, germicide, bactericide, fungicide, virucide, etc. Type and number of microbes, concentration, time needed, temperature, presence of organic matter, all these will affect the action of these chemical agents. The mainly used chemical agents are ethyl alcohol 70%, isopropyl alcohol 80%, benzalkylonium chloride, hydrogen peroxide, silver nitrate, iodine and iodine releasing compounds, chlorine and chlorine releasing compounds, cresols, ethylene oxide, etc. Next we can see barrier nursing. Barrier nursing may be considered as a nursing discipline where one would use the special gloves, masks, gowns to prevent the contact between sources of infection when treating with a critically ill patients and other highly contagious conditions and sepsis. Next we can see the barrier techniques or isolation techniques one by one. That first one is respiratory isolation. This is indicator where the pathogens are spread by droplet from the respiratory tract. The aspects include first one, keep a distance from the infected person. Next is to wear mask. Next is to wear gowns when caring for clients who has drooling of saliva. Next is ask clients to cover mouth with handkerchief or provide mask to the client. Restrict visitors. Next is a person suffering from respiratory disease or low immunity should not attend the infected person. The second method is enteric isolation. This method is indicated when the pathogens are transmitted in feces. Here the technique includes first one is hand washing. Both infected person and carrier should perform. Next is to wear gloves and gowns while handling soiled items. Next, soiled article or linen should be disinfected before washing or cleaning. The next barrier technique is wound and skin isolation. This method is indicated for pathogens which are found in wounds and can be transmitted by the contact with the wounds or by contact with the articles contaminated by the wound discharges. The techniques are wear gloves and gown, safe disposal of dressings and discharges from the wounds. Next, proper disinfection of articles used for wound dressing. Next is to keep separate articles for the client. Next is hand washing. And next is to avoid cuts and abrasions on the hand of the carer. The next barrier technique is blood isolation. This method is intended to prevent transmission of pathogens that are found in blood. It includes first one, wear gloves and gown and goggles if chance for a high splashes. Next is to disinfect articles used for the infected client. Next one is hand washing. Next method is use separate articles for the infected client. And to avoid cuts and abrasions of the hand of the carer. The last barrier technique is general precautions. Here, first one is to maintain high degree of cleanliness. Next is health teaching about the disease transmission. Next is to restrict visitors. Next is to emphasize on hand washing. Next is to keep toilet articles separate for each person. Next is immunization against common communicable diseases. Next is to protect persons with lower resistance. And last one is to follow isolation techniques when needed. Okay, thank you.